The other thing that we know helps with post-cancer treatment, cognitive changes, is physical exercise. And there's a couple of reasons why that works. One, we know generally that exercise does help get oxygen to the brain and improves cognitive functioning. So if you are exercising regularly, generally people who exercise regularly do better on tests of cognitive function than those who don't. And there's many studies in the research on this, and a recent study too that was done last year that found that in post-cancer patients that patients who exercised for 30 minutes a day 4 times a week had better cognitive performance a year later than those who were in the control group. Now, the other thing that may lead to improved cognitive functioning is we also know that physical exercise improves mood, so that if you exercise regularly, particularly cardio exercise, that can help treat your depression if you're depressed or stressed. And treating your depression or your stress is also going to improve your cognitive performance. So there's 2 reasons why physical exercise are important. One, exercise is just generally good for your brain and will help with memory and learning, but also it's good for your mood, which also improves memory and learning. So this is one of the more important things. And again, there was that one study that found just walking 30 minutes led to significant changes, significant improvement over the course of a year in cancer patients. So another reason to exercise. Now, exercising your body is good for your brain, but there's also brain exercises that you can do. And we know that the more you learn new things or do puzzles or play Scrabble or Sudoku or even learn how to play the piano if you don't know how to play the piano. The more you exercise your brain and get it to do new tasks, the better your brain is going to work. So any sort of cognitive enhancement strategy that you can use to exercise your brain and keep it going is going to be beneficial over the year, and you should start to see improvements as well. If you want specific exercises, there certainly are rehab specialists who you can talk to about improving your cognitive abilities. And they can give you specific examples as well. The other thing that you can do is simplify how you do things. Often this is done with an occupational therapist, like I mentioned before with the return to work issues. So work simplification generally means either cutting down on the number of steps it takes to do something, streamlining it, or organizing your workstation, or doing just about anything you can to try and make what you do as streamlined as possible. So work simplification, again, usually with an occupational therapist who analyzes how you're doing, what you're doing, and then makes suggestions about making accommodations or using strategies or slightly changing what you do. That can be very helpful, and it can mean the difference between being able to work and not being able to work in extreme cases. Now, the other thing you can try are memory strategies. So a lot of people resist even using a Post-it note and writing notes down and keeping notes, or you have stacks of notes. But using something like a PDA or a Palm Pilot or your iPhone to keep track of your life and have sort of command central in your hand can be quite useful. So you don't have to keep the details in your head. You can keep them in a journal or in a PDA to help you remember different things. And then as much as possible, you want to remove distractions. Because you can't focus on more than one thing at a time. Well, no one really can, but often after cancer treatment, it becomes especially difficult. So what you want to do is to keep the TV off, actually even turn off your email when you're trying to work on an article or a paper. You want to just do one thing at a time as much as possible. So when you're talking on the phone, you're talking on the phone. When you're listening to the radio, you're listening to the radio. When you're watching TV, you're watching TV. When you're working, you're working. And trying not to divide that up as much as possible. You know, you may have been able to listen to the radio or have the news on in the background before while you were preparing dinner. But there's actually quite a lot of steps in following a recipe. And it's surprising how after cancer treatment it can be a challenge to follow a recipe, because you have to keep all the different measurements in your head and what steps you've completed and what are left to be done. There's actually a lot of cognitive skills involved in just opening up your cookbook and following what's inside. And if you have distractions in the background, it's going to make it harder for you to do that. And you're going to feel more tired at the end of the day. And that's the bottom line. The more distraction you have, the more depletion you're going to have as well, the more exhaustion. Now, another important thing for everybody, but particularly after cancer treatment, is working on reducing your stress. We know stress has a very significant impact on your ability to think, remember, and learn. And when you learn how to stay in the present moment and not worry about the past and not fret about the future, staying in the present moment is going to help you concentrate on what you're doing. It's going to help improve your attention, and just being mindful of what's happening in the moment is going to lead to better performance in thinking and remembering. So there's a number of programs here at Tom Baker. There's a mindfulness-based stress reduction program. We also have regular stress management in a day programs. One is coming up this November. So you can check with the Department of Psychosocial Resources here for the stress management classes when they're coming up and when you can sign up for them. Practicing relaxation and different techniques can also be useful. But and simplifying your life so that you reduce the number of stressors as much as that's possible can be important in aiding your memory. And finally, patience. It can be very frustrating to have memory problems or to have difficulty learning, especially when you know what you used to be able to do. And getting angry at yourself or angry that you have cancer is only going to add to the frustration and increase the problem. So in one of the other podcasts I mentioned, when you're angry that you're angry, and you're sad that you're sad, and you're depressed that you're depressed, or you're frustrated in this case that you have memory problems, you're going to double your suffering, and you're going to make it that much harder for you to learn how to adapt with what you have right now. And it also, if you're not patient with yourself, you also forget what you still have in terms of the information that you didn't lose. You probably didn't lose IQ points, although that can be frustrating too, because it's all in your head, but you just can't get it out. And you look normal to other people, sometimes even to the doctors or the people who test you. I mean, I know many patients who've gone for testing, and they've actually scored very well on the test, but they knew they are not what they used to be. So that can be kind of frustrating as well. But learning patience for what you're facing right now is going to, in the long run, actually improve your memory, because you're not wasting energy on being frustrated with yourself. So where can you go for help if you think that this is a concern? Well, the first step is to talk to either your oncologist, if you're still seeing your oncologist, or your family doctor, if you're discharged to them for your care, and talking about some of the changes. And you want to rule out any physical causes for any cognitive changes that you have. So you need to get your blood tested and everything checked up to make sure there isn't a problem like anemia or nutritional deficiency. And as much as possible, rule out those things. And then you can also come to if you're a patient here, you can come to the Department of Psychosocial Resources if you're concerned about your mood, if you have a lot of anxiety, stress, or depression. There are a number of different programs here that you can come to, either individually or in a group, like the mindfulness-based stress reduction program, that treating that underlying stress is also going to help with your memory. Now, let's assume that you've taken care of your body and your mind, and you still are struggling with some memory problems. If you're very concerned or you're having difficulty returning to work, you can certainly talk to one of the therapists here or your doctor, and you can be referred to, well, at the time of this taping, it's the Calgary Health Region, but we're transitioning over to Alberta Health Services. But there are neuropsychologists who work in the healthcare system here in Calgary that you can be referred to for sort of a